this is so important, but giving owners sufficient time to come to terms with the diagnosis that's been made, to adjust to what kind of prognosis or time might be available, and help them really say goodbye in whatever capacity that they need to. I think that there's always the fear, like you mentioned, that you've kept it going or kept them alive for too long, and I think that, I'll get to that a little bit later too, but I think that comes up in every single one of these situations, and the one thing I can say is that it's okay to need that time to a certain extent, and I think that you do have to really rely on a veterinarian that you trust and helping you to realize when that is. So ultimately for me, hospice is recognizing that very, very unique bond between the owner and the animal, and working with the veterinarian to honor that bond through the development of a management plan for that pet's last remaining time, however long that is, days, weeks, months, years. But it's a plan that I think everybody needs to be on board and on the same page with. One thing that was very surprising to me when I started reading through all this is that when Jennifer mentioned to me about speaking with, I thought, oh yeah, hospice and death, and I really felt like it's something that although I deal with on a daily basis for my clients and with their patients, I really didn't feel like I had ever been, I've been very fortunate I haven't had to make those hard decisions for my own pets, I thought. My 15-year-old Sheltie passed away in September, and what I realized was that although she didn't have a terminal disease, she had chronic bronchitis. It was still something that I couldn't fix. I couldn't take it away from her. All I could do was manage it and do the best I could. It called into question all of the quality of life versus quantity of time aspects with her. When it finally came to the point that I put her to sleep, it was because she had a very, very violent seizure. And what I realized looking back on all this is that I did have a plan. My plan was to keep her as comfortable as I could. If that meant lots of steroids and she had a shorter life, that's what it meant. When she crashed on me, I chose to euthanize her. I had a plan. She was under hospice care. I hadn't put that title to it, but she absolutely was. And so I think we find ourselves in that situation a lot more than we realize it without maybe putting the courage to it. When I talk about this plan, as I mentioned before, I think it's so important that it's something that you have been very frank with your veterinarian about what your ethical beliefs are towards end of life, towards euthanasia, towards quality versus quantity of life. I think that you really need to make sure that they understand what your emotional needs are so that they can help honor your choices and your decisions, and yet at the same time help you to understand when maybe those you no longer have the luxury to do that. I think that it needs to be set up early. Like with my dog, I didn't realize that I was in hospice when I was, but I think really talking about it from that standpoint, talking about the plan and talking about it often, because it is something that changes. When I say setting it up early, a couple of kind of benchmarks as far as when is hospice right or when do we consider an animal under hospice care. I would say once we realize that this animal has some kind of disorder or disease that we cannot cure, we may be able to somewhat manage it or slow down, but if we cannot cure this disease, from that point forward, everything is a management and quality of life plan. I think it's important to talk about whether or not the owner has enough time and financial resources to really devote to a hospice plan. If you're going to be gone 20 hours a day, that may not be the best situation to have a critically ill animal in your home. I think those are valid concerns, and again, I think it's important for the veterinarian to be very upfront with what this animal's care is going to require and find out if it's something that's reasonable or not. I'm not sure the best place to mention this. It's kind of talking about how it's a plan and it can change. I am going to mention that one now. I had a client who I had the unfortunate experience to have to tell her that her dog has osteosarcoma, which is bone cancer, and it's an extremely aggressive and fatal cancer, and it's one that we really have nothing to fight. Chemo doesn't work, radiation doesn't work, it usually attacks the limbs, and the best thing that we can tell people to do is amputate that limb as strictly a palliative procedure I made this diagnosis,